Welcome to the Virginia Mason General Surgery Residency Program. I'm so excited to share with you all of the aspects of our program that make us so great. People always ask me what sets Virginia Mason apart from other programs, and I always have to pause and ask myself, what should I brag about first? I think what makes us unique is that Virginia Mason is a tertiary care referral center that blends an urban medical center with a community program and strong academics. Our perfect mixture of these elements allows our residents to gain an earlier experience across the continuum of patient care, from the clinic to the OR to the inpatient wards. This benefits our residents in several ways. First, it accelerates our residents' growth as young surgeons. In addition, it creates a close-knit and strong community between our residents and the faculty. We also have a very strong focus on giving you the tools and the foundation to prepare yourself for life after residency. Believe it or not, residency is merely a stepping stone to the rest of your life. We are here to prepare you for a career as a surgeon.
I think Virginia Mason is one of the best and maybe the best places to train in general surgery in the United States. And one of the factors that contributes to that is our case mix. You might not realize it, but Seattle is the largest city in a 5-state region, and that includes Washington, Oregon, Montana, Idaho, and Alaska. And anything unusual from that entire area in the Northwest tends to get referred to the big city and frankly tends to get referred to right here, Virginia Mason. And our residents are benefactors of that referral base. Our residents graduate with greater than 90% of the complex cases, things like pancreatic resections, esophageal resections, lung resections, vascular surgery, complex minimally invasive like colorectal and bariatric.
My name is Dr. Hubka. I'm a thoracic surgeon here at Virginia Mason. At Virginia Mason, we have a very busy esophageal and pulmonary thoracic robotic program. The robotic curriculum starts with online training and is followed by simulation training. Then you graduate to be active in the operating room. We have 3 Da Vinci systems. 2 of the systems have a training console which allows us to work simultaneously with the resident. We really believe in the benefits of robotics and also the future of the technology. We think robotics is an integral part of your surgical training at Virginia Mason. As such, all of our residents become robotically certified by the time they graduate.
I think the culture at our surgical residency program starts with the education, which is both constructive but caring, the support that you feel, or everyone is really there together to make you the best surgeon and best doctor that you can be. And that support is not just from the faculty, but also from my co-residents. We get the privilege of seeing what it really is like to be a surgeon in their day-to-day. I've seen patients worked up in clinic, followed them through to the OR, taken care of them in the hospital, and then had the pleasure of seeing them recovered and well in a post-op visit.
One thing that sets Virginia Mason apart is the culture here. When you have a very close-knit group of surgeons, such as ours, working with a cadre of residents over the course of 5 years, you develop a lot of trust. One of the particular strong suits of our program is mentorship. In addition to assigned mentors, residents also have the opportunity for mentorship in the operating room, in the ICU or the wards, but also in clinic. We really produce fantastic residents with excellent skills and the ability to cope with the changing face of medicine.
One of the reasons why I was really drawn to Virginia Mason was our early exposure to complex cases and the opportunity to operate early, even as interns. One of the things that Virginia Mason does a great job of is preparing us for our futures. About half of our residents go on to pursue additional fellowship training, and the other half go straight into practice as general surgeons. And whichever way we choose, we have support from our faculty 100%.
One of the strengths of our residency program is the ability to offer residents opportunity to pursue their own career path. Those that go into private practice in the community, whether it be urban or rural, become outstanding surgeons in their communities. On the other hand, there are those residents that might want to pursue fellowship. Our residents almost always obtain the fellowship of their choice, Most of our teaching faculty have national or international reputations, and they're well respected. Fellowship programs and universities know that when they have a resident coming from Virginia Mason, they know what that product is.
We get along great with our attendings. They are not only very strong clinically, but they're really good people who are just great to work with. We get to work very closely with them. They're very patient in the operating room. They teach extensively on rounds and in clinic and are available for a multitude of research projects. And they're available at all times when we're on call. Naturally, this creates an environment of mentorship, and this continues both on and off service. And they're invested in our growth just as individuals alongside as trainees. You know, as someone who just came off paternity leave, one of the things I've grown to appreciate is how much our program cares for us. We have a meal stipend, we have free parking, and we have flexibility to do things like paternity leave. This really makes you feel like a valued member of the Virginia Mason team.
One of the things that our residents get to participate in are indications conferences. We talk about our cases for the upcoming week. We all review imaging and operative planning together. There are also multiple multidisciplinary conferences, such as tumor boards for our cancer patients, and also multidisciplinary inflammatory bowel disease conferences where we talk about all of our shared patients with Crohn's and ulcerative colitis with the gastroenterologists. We really have excellent relationships with the other specialty surgeons and specialists here at Virginia Mason. That includes the urologists, the gastroenterologists, oncology, radiology, and you as a resident will really benefit from that. One thing that's really special about our residency program here at Virginia Mason is the accessibility of the attending surgeons for the residents of all levels. Whether you're an intern or chief resident, our doors are always open, and our staff is very willing to discuss cases, review imaging, and talk about operative planning with the residents.
Early exposure to research is critical for a surgical career, and here at Virginia Mason, all of our categorical residents are involved in research. There's ample opportunities for them to do so, ranging from clinical databases, new and ongoing clinical trials, multidisciplinary collaborations with other specialties, and perhaps most importantly, a series of passionate faculty mentors about surgical research. Residents can accomplish their research either during their clinical years or opt for a fully funded, dedicated research year. Either way, they're extremely well supported. This includes grant funding opportunities, support for IRB submission, data analysis, and presentation support. This results in an extremely productive research portfolio with presentations at local, national, and international meetings, and the residents' travel and research expenses are funded through the Graduate Medical Education Office.
My favorite part about living in Seattle is definitely the vast amount of nature that surrounds us in every different aspect. On any given weekend, I'm kind of exploring in the Olympics or Mount Rainier or down at the coast. I also love that Seattle is just filled with so many different foods and cultures, and you really kind of have whatever you want at your disposal. There's so many different parks. It's a really great town for families, for people who love to be outside, for people who love to go to museums. It kind of has a little bit of everything. It's hard to choose my favorite parts about Virginia Mason, but I'd have to say that the people, the camaraderie, the fact that these are my friends, not only in the hospital but outside, make it truly a unique and special place, along with the fact that I have been able to get into the operating room and see a vast array of different pathologies, even as a second-year resident. It just makes it a really special and remarkable place.
I hope that you choose Virginia Mason. We can't wait to welcome you.
We invite you to learn more about our program through our website at vmsurgery.org. I do hope you consider our program as you look at different residencies, and we wish you the best of luck through the interview and match process. Thank you.